Why do you need a physiotherapist? Why do I need a physiotherapist? What are the things that a physiotherapist will tell you or tell me that probably a doctor would not tell you or would not say in details? These are the conversations we want to have this morning. And to have that conversation with me, I have with me in the studio Dr. Anamneze John Uche. He is a physiotherapist with a master's degree in physiotherapy and, of course, a vast range of academic and field experience in patient counseling and patient management. I have the pleasure of introducing, once again, Dr. Anamneze John Uche in the studio. Yeah. Welcome. Thanks for joining me.
Thank you for having me. It's great being here.
All right. So why do I need to see a physiotherapist? I mean, my body functions are okay. I don't. So for me personally, or let me say, if any random person walks up to you and says, why do I need to see a physiotherapist? What is the importance? What would you tell them?
That's okay. But for you to know why you need to see a physiotherapist, you need to know what physiotherapy is all about. So physiotherapy is a medical profession that uses physical modalities, techniques, skills to bring about functioning, movement, improve quality of life. You know, things like if you have body pains, weakness due to a body disease condition or so, we want to address that. So physiotherapy spans through all sectors of health, the primary, the secondary, the tertiary health sector. In fact, there is a preventive part of the physiotherapy. We want to prevent something from happening in the future. And that's where the primary health sector comes in. So nonetheless, physiotherapy, why would anyone need a physiotherapist? We all have it as humans, we must be on the move at all times.
Yes.
We're on the move, you sit, you work, you go around and all that. Anything could happen at any time. We all need physiotherapy at some point in time. It may not be throughout life, but for us that don't have any issues medically, literally,
yes,
until you go through a checkup or physical fitness, for instance, you get to see how your abilities, your agilities, if you have strength, endurance, your cardiorespiratory systems are functioning. So all that comes into play into your fitness. You know, you need to, with physiotherapy, you'll be able to prevent certain musculoskeletal conditions, your cardiac conditions, not yours, but...
Of course, I understand. Please go ahead.
You get what I mean? So if you're physically fit and you engage in exercise activities that will help you physically, that will help prevent a lot of factors, a lot of conditions, and in the future, you'll still be going alongside being fit and being strong enough to carry on. So physiotherapy has that way of slowing down aging, in the sense that when you get to exercise, for instance, the United States Department of Health advocates for 3 to 5 times a week of exercise of 30 to 60 minutes as humans. So you imagine you put your child in school. And they have 30 minutes of break every day. So that 30 minutes of break multiplied by how many times they have to be in school. So they've actually met up in terms of being physically fit. But as adults, we find ourselves going to work, doing certain activities at job. We sit more, or some of us get to 10 more, depending on the definition of...
Let me jump in right there before you continue. If I get you correctly, what you're trying to tell us now is that there's a need for us to check our body system, the way our heart rate, cardiovascular movements, our body motions. There's a need to specifically go into a hospital to check.
Yes, there's
so
need to do
you
that.
don't have to wait to feel pain?
No.
Okay. Yeah. Now, what's the benefit of doing that? Is it to preempt if there could be a problem, or is it just to be aware of what your body needs? Which of them?
Both.
Okay.
In the sense that, one, you want to prevent if anything could happen in the future. God forbid, let's say you go into the hospital and you go through the physical fitness test, and you realize certain parameters are already on the high side, for instance, your cholesterol level, and that could cause you stroke in the future if not controlled, or that could cause the person stroke if not controlled. So you want to go into physical activity by trying to use certain drugs first. In line work, of course, is a teamwork. You don't work in isolation. with every other team members, the doctors, the nurses, like that.
Okay.
So you want to have the drugs to control your cholesterol level, and you want to also keep the exercise that make you physically fit, so that you don't tend to develop these conditions in the future. Now, in the other part you mentioned about getting to prevent anything and getting to have any problem, you want to sort it out.
Yes.
If in the course of the examination, because as a physiotherapist, we also examine our patients, examine our clients, for those that are not having any issues. So you want to say, did this person, is it predisposed to having certain issues in the future? Like some persons tend to, we generally, Nigerians, we tend to develop wrong ways or body mechanism of doing things. For instance, most of the times we find ourselves trying to pick things on the floor. We bend our backs instead of squatting our knees. And that could predispose the person to having repetitive stress syndrome, which will come out in the form of neck pain or back pain.
Can you take that again? So you have mentioned now, because I was even going to ask you if there was a prescribed way of doing certain things, like the day-to-day activities, like how do you use, when you're in the bathroom, you want to shower, what's the process? When you want to pick something on the floor, what should you do? I was going to ask all of that, but you're ahead of me in time. So you mentioned something, you said repetitive stress syndrome.
Yeah.
What does that mean in full?
Okay, I'll take it stage by stage.
Okay.
When you begin to do a wrong thing with the wrong body mechanism, the wrong body posture, wrong body patterns, and you do it over and over, it may not come in a day or 2 or 3, it may come in months, it may come in years.
Okay.
Eventually, by the time the person comes down with that syndrome, it may be in a form of back pain or neck pain, or some persons, medical team workers, they call it spondylosis, for to be the spine. Or though some other persons may have knee arthritis, things like that.
Okay.
So because of wrong postures, wrong techniques, it predisposes the persons to having these musculoskeletal conditions.
Okay, speaking of that, just before we go on, we have a comment coming in from Facebook from Daniel O. David, who said that from personal experience, physiotherapy, we all need physiotherapy. And thank you very much, Daniel, for that comment. And I am very sure that Dr. John here would agree vehemently with you. Now, that said, so it means that our daily activities actually have a way of predisposing us to pain and illnesses.
Yes, it does.
So that said, I would like a situation whereby maybe after our conversation, you can practically show us what or how to pick something from the floor. We'll do that. We'll take a break and we'll do that. But just before we head into that, I have another question for you. So take, for instance, an accident victim, who at the time of the accident didn't have any major injury anywhere. And then you suddenly see, what's it called? You suddenly see that maybe 2 years, 3 years, 5 years down the line, the person suddenly starts to feel pain in a certain joint or a limb or somewhere, maybe the bone or something. What does the physiotherapy do then? If
I get what you mean,
pain that doesn't present until years after the trauma.
Well, 2 things could come into play. One, probably it wasn't discovered earlier, the scenarios that could have predisposed the person to having this kind of pain in the future. Probably they involve a physiotherapist at the earlier time to prevent it from coming up. But if it comes up, it's not going to be like we run away from it, but we still have to manage it. Because nobody likes pain. Pain is like a monster in our skin, in our body. So we want to also address that. Because WHO says pain is one of the 5th sense, in such a way that it's a protective mechanism that tells you something is wrong. So you need to go back to the source and find out what's wrong, sort it out, and carry on. As physiotherapists now, if your challenge needs a physiotherapist, you're having pain, and a physiotherapist will have to assess you first, evaluate, okay, what kind of pain are you having? Is it because of your muscles, your nerve, tendons? Could it be even a cancer pain? because some of these pains could be referred from your internal organs and all that. And so you may not necessarily still need a physiotherapist.
Okay.
For instance, you could have kidney issues and it referred to your abdomen and all that. You may have appendicitis, start having pains and cramps in your abdomen. All you need to do is to sort, just sort that out, and that takes care of the pain.
So I was going to ask you before we went on break that what set of people need physiotherapists? You're old, young, is it people that are sick, people that had an accident? What set of people need physiotherapists?
Or I do get that kind of question all the time.
Okay.
We all need physiotherapy at some point in time. But it's not about the age, it's not about the gender, again. So physiotherapy could see a child of a day or two old. Okay. So range to an older adult of 90 years, 96. So it doesn't matter. Now, that's where we can talk about specialty in physiotherapy. So we have different specialties. Okay. The easiest ones you could come in play or come to your mind is the orthopedic physiotherapy, because people say, okay, they break their legs, the bones and things like that, and you say, I need a physiotherapist after your doctor tells you to help you learn how to work again and do things. So that comes to, that's in mind. We also have other areas like neurology. We have geriatrics physiotherapy that has to do with older adults. Then you have pediatrics that has to do with children, depending on the challenge they now have. Some children may be given at birth, may have issues with prolonged labor and may have brain damage. It may be irreversible. So you need a physiotherapist to train them again. In that, we call it habilitation, because they haven't learned the activity, the way of working, doing things, standing and all that. But for an older adult, someone who is already doing things, but because of the disease condition could not do those activities, those functional abilities or independence is lost. So we as physiotherapists have stages of, after review, we could change and progressively use certain exercises and techniques to help the person gain that function back. That's like you see in a stroke patient, someone has weakness in one side of the body, learning how to work, use the hand and do things, and most instances, the person gets back to normal or close to normal. Ability to do all that. Possible. Yeah. So for the older adults, those are above 60 or 65, we classify them into the geriatric physiotherapy, where we tend to do certain exercise to keep them fit, because as the brain, we have what called neurological atrophy. The brain begins to get smaller and weaker as we age, like that. So some other persons may come down with certain conditions like Parkinsonism and all that, that they may not be able to do those activities they used to. So you need physical therapy to help the person get back.
Something crossed my mind. When you talked about pediatric physiotherapy, it reminds me of a set of people that recently started baby massage, teaching babies to swim. Does that fall in that category?
Wow.
Especially the baby massage thing.
When I hear baby massage, it strikes me. As physiotherapists, massage is one of the techniques we use, but we don't tell people we want to massage. We tell them we want to give you therapeutic massage because you are doing it for treatment. Now, if a baby can't do certain things, as I said, we call that delayed developmental milestones. So you want to train the baby back again. Yeah, some persons may use water, we call that hydrotherapy, because it's water takes off the frictional force of the ground floor. So it becomes easy to do exercises in the water, and resistance can be trained better. So that improves function quite faster than on land.
You were going to give us a demonstration on how to pick something off the floor without putting strain on your spine. So we're going to use this as the object to pick, and let's see how. Okay. Now, you have to show us how to pick that off the floor.
Well, naturally, humans, we tend to bend our backs most times, either in sitting or in standing. Most times it's in standing when we tend to pick things. We tend to repeat this.
All right.
And this is a wrong body mechanism.
Why is it wrong?
It's wrong because your back muscles are not as large as your thigh muscles. It's easier to bend your knee, squat, and still pick. My back is straight. I don't have to twist and strain and all that. If you want to drop it, the same thing. So it depends on the kind of objects you're going to be handling. So if you're going to have a larger let's say something bigger, has more weight.
Like a big gen or something?
Well, something
or
like...
something, a bag of cement.
Wow, for instance. For those that are not muscular, like
of course,
I am now, you may not be able to do that. But in doing that, you may strain your back. That will cause you what we call disc herniations, and you start having entrapment and sciatica pain, shutting down your legs. So you want to avoid that. So it's easier to, if the weight is so much you can't pick alone, you have to get help.
Somebody,
someone to assist you, and you squat. Of course, from your knee, you can push all the weights back because the larger muscles are strong enough to take all the weight. But your back muscles may not be that strong. And apart from being strong, it's a wrong technique to avoid you having issues in the future. So
say I want to pick up a briefcase, a suitcase, a bucket of water that is not centered in between my legs. So how do I do that?
There are other ways you could do it. You could go on your side. Still maintain your back straight. All you need to do is squat down a little and get to the height of your briefcase, and you pick it up, or the bucket handle. So I'm a lady. I like my short dresses. I need to pick something, and I'm wearing a short skirt. How do I do that? Well, and I'm on heels. How do I do that squatting? It's, in a way, we are limited by a lot of factors. But then it's still similar to what I said earlier. All you need to do is go by the side of what you need to pick. You don't need to close up so much so that you don't lose your balance. So then all you need to do is go down a little bit more, and you pick what you need. It means that you need to have strong quads to do that. Your thigh muscles has to be strong.
Hello there. Did you just enjoy that beautiful video? Don't worry, we have more for you. All you have to do is click on the subscribe button and ring that little bell for more notifications. Tea or coffee will be served for you.
Because of wrong postures, wrong techniques, it predisposes the person to having this musculoskeletal condition.